At first, I had no idea what diabetes was, neither did my mom.
Every year in the United States, approximately 13,000 children are diagnosed with type 1 diabetes.
No family history. I was completely freaked out.
You shouldn't freak out or panic. You should ask the doctors what to do.
The diabetes team consists of the pediatrician, a pediatric endocrinologist, diabetes health educator, and a dietitian.
It has taken me as a parent, siblings, teachers, doctors, the American Diabetes Association, the whole community is Micah's team.
The first thing you want to do if you have a child with diabetes is to make friends, family members, teachers, and school administrators aware.
I would start by going to a class. Family, friends, anyone you can introduce is allowed to go to these classes and get trained.
The next thing you want to do is have an action plan or a tip sheet.
I basically introduced the school to diabetes, and now there are 5 teachers who are trained.
Some of the things to put on a tip sheet are signs of hypoglycemia or low blood sugar, contact numbers for parents and the child's doctor, and sources of emergency glucose, such as glucose tablets or juice. It's so important to monitor blood sugar levels because we want to keep everything in range. You don't want it to be too high and especially not too low. The traditional way to monitor blood sugar is to prick the finger and get a small drop of blood and use a test strip and a glucose meter to get a blood sugar reading. A continuous glucose monitor helps because parents can know what their child's blood sugar is at all times. And even if the blood sugar is high or low, you can set alarms to let you know what's going on. All parents should have a glucagon emergency kit on hand at their home and at the child's school.
This is my diabetic bag. This one is for school. I have a school one and a home bag.
It has a blood sugar glucose monitor system in it. Juice box is always in there, some kind of carbohydrate snack. He has glucagon pen in there for if he was to pass out. He has his daytime and nighttime insulin with him.
It's easier now than it used to be to manage diabetes for children, and that's because of all the new technology. There are new things coming out all the time, so parents should do research about apps and new technologies so children can grow into learning how to manage their diabetes by themselves.
He makes this so much easier for me because he's not as dependent on me, so I have to stay aware so that I stay up with him. He does not let it stop him. Does he get discouraged? Absolutely. Do I get discouraged? Yes. Sometimes he tells me, Mom, you don't need to be discouraged. We got this.
All this stuff is a bit overwhelming, but since I've had it for about 3.5, 4 years, I've got it down. And it still is a little frustrating to do all this, but I learned to go with it.